Well, Jeffrey Brook is an associate professor at the Dalla School of Public Health and joins us now with more on the concerns surrounding this poor air quality. Thank you so much for joining us, Jeffrey. I'm very curious about a lot of these particles that we keep hearing about, how harmful they are to be if you're breathing them in. Tell us about some of the risks associated with some of this air quality and what can happen to someone if they have, I guess, too much exposure to these particles.
Yeah, it was interesting to hear just now that only about half the people were really concerned, and that half of the people are those that have pre-existing conditions like asthma, COPD, and other things like perhaps are battling a respiratory infection. And I'm sure that they're feeling it big time and not able to enjoy like others can. And that's the first thing we worry about are the vulnerable people and what they're feeling and how they can protect themselves, because it can lead to much worsening symptoms and needing more medication, not being able to do anything because of the way they feel or the concerns they have. And ultimately, we see those in numbers of increases of visits to the emergency department as the smoke particles get into the lungs.
Well, speaking of protection, I'm sure a lot of people were, happy to put their masks away after coming out of the pandemic. But, from what I'm hearing from some experts, that maybe, breaking out the N95 might be a good idea, especially if you're an outdoor worker and you're being outside for long periods of time.
Agreed. Yeah, every little bit helps with respect to preventing what we get exposed to. N95s offer the best protection if they're fit well. And thanks to COVID, I think there's more options for good masks that are also easier to breathe in. So definitely don't be shy to wear your mask. Every little bit of reduction in inhalation of smoke is a benefit.
This is something that I'm sure many people in Toronto and some parts of the GTA were not used to this. What's your take on all that's playing out? Obviously, this is, very concerning, but when it comes to the environment, when it comes to the climate change, I'm guessing this particular issue kind of, touches upon something that are, bigger problems than just the fires that are happening, but things that are happening in our environment.
Yeah, as anyone looks at, what are the health implications here in North America of climate change, one of the things that's at the top always that have been quite confident is a risk and will happen are more wildfires and more smoke exposure. And so it's not a surprise. We've also been seeing these types of events happen all around the world with increasing frequency. It happens to be now closer to us with just the right meteorology. So while we're not running from the flames, we've got smoke, which we can't really run away from. And that's again, something that we just have to step back and say, look, are we doing enough to deal with climate change? Because we're charting a new course now with air pollution and with respect to these sorts of impacts, whether they be forest fires and smoke or increased flooding. This is heading in the wrong direction if we don't really turn the corner quickly.
And lastly, Jeffrey, we're heading into the summer months. A lot of kids are being sent up to camp for overnight camp for 1 month, 2 months. You've got a lot of people that are going to be up north at their cottages. And just moving forward, what's the advice for parents who are sending their kids away to camp that might be exposed to some of this smoke, and also advice for some of these camps that are going to be having who have all these outdoor activities planned at a time when we're seeing this smoke kind of move into the region?
Yeah, kids are more vulnerable because they are active and particles deposit in their lungs differently than adults. Some are very young and their lungs are even developing because lungs grow well into our teens. And so first and foremost, parents should be talking about their kids and being aware of the smoke and aware of how they're feeling. And definitely take it easy if they're feeling short of breath or any other unusual symptoms. Masks are always good to have on hand, as we talked about. The first step, though, would be to not overexert yourself. And if you are really feeling that things aren't right, make sure you're approaching a medical person right away to let them know. Don't try to tough it out. Go for help.
Well, Jeffrey Brook with the Dalla School of Public Health, we appreciate your time and perspective. Thank you.
Yeah, thanks, Jamie.